Now, the last area is very related to what Patrick's going to talk about, and that's a segue into introducing him. More patients will have access to mental health coverage as indicated and called for in mental health insurance, Medicare, and Medicaid. We need to make sure that people with mental health conditions have access to affordable and quality care. And we keep saying, go get help. But guess what? When you can't afford help and you can't find help, it's a problem. And so we're not going to reduce the suicide rate if we don't focus on that, which has been something Patrick has become just an amazing leading voice in our nation and a real champion for. So while he needs no introduction, I'm going to introduce him. And so the Honorable Patrick J. Kenedy is a former member, as you know, of the House of Representatives, and really the nation's leading political voice on mental illness, addiction, and other brain diseases. He was in Congress for 16 years representing Rhode Island, where he really fought a national battle. And think about when Patrick was in Congress, no one was talking about this, to end both medical and societal discrimination against mental health conditions and addiction. And that certainly led to what is really a landmark piece of legislation that he sponsored, introduced, which is the Mental Health Parity and Addiction Act. It's hard to believe, 2008, and yet it's not fully implemented, and he's going to talk about that. But also he was brave in talking about his own mental health challenges and continues to do that, and certainly did that again this morning on C-SPAN. So he has founded, since leaving Congress, he's devoted his career now to this topic and has founded the Kenedy Forum, which has just been a driving force for mental health parity and equity and ending discrimination. So his new book, A Common Struggle, outlines a bold plan for the future of mental health and addiction services in America. He's a close native. I'm in New York, he's in New Jersey, but he lives in New Jersey with his wife, Amy, and I can tell you, he is a friend, a colleague, and a real champion, so it's an honor to welcome Patrick Kenedy.
Thank you very much, Bob. You did pretty well for only 4 hours over the last 48 that you slept. And thank you for your leadership in bringing this movement out of the darkness. Under your leadership, people have really found a voice and someone who can champion a political advocacy that we desperately need in this space. And to you and all of those who work at American Foundation for Suicide Prevention, and especially all of you who've come from all over the country to be here today, I want to thank you. Democracy doesn't work if people are not speaking up and speaking out. And these, of course, are illnesses that have kept people silent for too long. And part of our problem is that this is kind of a self-inflicted situation where we're so anonymous that we can't come out from the church basements and say that in the same way we would if it were any other issue, from the environment to civil rights to labor rights, what have you. You have movements all over this town with big offices and huge national constituencies who represent a population, a fraction of the size of the people who are affected by suicide. And they have got huge operations. And the reason is because advocacy for those issues isn't something that people are quiet about, because they're worried someone's going to find out. And so I just want to say to all of you, thank you for coming out of the darkness yourselves and giving this issue a voice here in Washington, D.C. So growing up, I used to drive with my family to Cape Cod. Might be familiar with that. We used to go over the Sagamore Bridge, for those of you who've been up there. And year after year, I saw the same billboard as we crossed onto the Cape. It said, "Desperate, call the Samaritans." The sign stuck with me, not the least of which because of my own feelings of desperation were bubbling underneath an otherwise very enviable life that I had. When I got to Rhode Island as a college student, I went down to the United Way and I signed up to be a volunteer for the Samaritans, answering the phones for their local suicide hotline. I was known as Patrick 507. Happy to report that after I signed up, the CEO of Rhode Island United Way became Tony 508. I don't know why that happened. Maybe he said, "What? We have Samaritans in our mix of, endeavors we support?" And then my wife Amy's here, and after we moved I moved to New Jersey to be with Amy, my Jersey girl. So we live in a little community in Brigantine, and bless you, right next to where one of our neighbors, it was the CEO of Atlantic Care, the largest healthcare system in South Jersey. And in much the same way, I'm proud to say that recently, in the last couple of years, Atlantic Care became Zero Suicide certified by Mike Hogan and the Zero Suicide Initiative. So all politics is local and personal. Amy redesigned the CEO's house. And next thing we know, Atlantic Care is the first system in the nation that became zero suicide. Not only the hospital, all their docs across all their medical specialties were all trained in multi-day, seminars. And so I hope all of you in your own areas are pushing that, because we advance the mental health of all when we ensure zero suicide prevention is the standard for all of our medical care, so that there are no gaps for people to fall through. And when we have clear signs or people are in distress, we respond right away in the same way we would if it were any other medical condition that presented itself in any part of the healthcare system. And that is what Zero Suicide program has done. And I salute Mike Hogan and all of those who are part of that for the work that they do. So I went through many hours of training and volunteering, and throughout that time I learned a very important skill, and an unusual one for a Kenedy: how to say nothing. Coming from a family of orators, I have always understood the power of words, but I didn't understand when I walked into that volunteer job about the power of listening and of hearing. As a college student, I couldn't pass laws. I didn't control any funding. I had no influence over the country's schools or jails or communities. But I could pick up that phone and magically, just by being there, make someone feel heard. And that made a difference. The overnights were the busiest. We got calls from people from all walks of life. And by the end of my shift, I felt spent, but at the same time, I felt full. I didn't know the callers personally. This was before caller ID. I couldn't see them and didn't know where they were and where they were calling from. But every time I hung up my headset, I thought, thank God for Samaritans and that someone was there to answer the call. I am glad, Bob, that you're making such an emphasis on at least improving the dollars attributed to the suicide hotline which are woefully short. No one should be put on hold if they're calling in a crisis, and that is just inexcusable. A lot has changed in the field of mental health since I was in college. We've made great gains thanks to the dedication of many in this room who are passionate advocates. We've also made all of those gains, but in spite of that fact, we have failed. The numbers are going in the wrong direction. In less than 2 decades, suicide deaths have increased 30%, drug overdoses have increased 250%. People who live with mental illnesses are getting more desperate and receiving less help. Now more than ever, we have to answer that call. When I was elected to go to Congress, believe me, I did not go to Washington to become the nation's voice on mental health and addiction. For several years, I tried to add mental health and addiction to my legislative agenda without calling any more attention to my own situation or providing any more personal information. This was the mental health equivalent of don't ask, don't tell. Then on May 6, 2006, I woke up at 3 a.m. thinking that I was late for a vote. I drove under the influence to the Capitol building and crashed my car into a security barrier. On TV the next morning, I was forced to tell the truth. And that, my friends, is one of the biggest problems when you have a mental illness or struggle with an addiction. It's the secrecy, the lying, and the self-delusion. Our secrets are our most formidable adversaries. They are the enemy within that blocks our recovery. Those of us who have struggled with addiction know the importance of incremental change. It lives in our mantra, one day at a time. But in recovery circles, there's often another suggestion, and that is the only way to fully heal is to, quote, change everything. As advocates, as leaders, we have tried incremental change, and it hasn't worked. And so I submit that this is the time to fight for fundamental change. This is the time to change everything. We must no longer stand by as deep-seated discrimination fuels our diseases and threatens our lives. We have to stop working in silos. It's time to stop treating every mental health disorder as its own separate interest group. In my opinion, it's wrong to simply say that there's an opioid crisis in this country, or a bipolar crisis, or a suicide crisis. What we have is a mental health crisis. Yes. When we let ourselves be defined and divided, we lose ground in our collective fight. That isn't easy to say because these illnesses do manifest in very different ways. But they do originate in the same organ. They do result from the same set of complex networks of biological, psychological, and social factors. And it helps none of us to spend time fighting over whether we should be looking at depression or anxiety, addiction or alcoholism. At a fundamental level, all of these diseases require the same thing: holistic and comprehensive care. But changing everything starts with breaking the cycle of denial, coming to what we in recovery call a moment of clarity. That's the moment when you realize you can't do this anymore and that the pain is too great. When as a society are we going to say, we can't do this anymore? When are we going to accept that we can't keep this a secret anymore? When is the pain going to be great enough for our country to come around and finally address the epidemic of suicide and addiction for what it is, a public health epidemic? So I'm here today asking for all mental health advocates to unite behind an important initiative, Mental Health for Us. You got that? For us, for US? This initiative calls for the kind of large-scale fundamental change we've always needed and never achieved. Because let's be honest with ourselves. We have Surgeon General's reports on addiction. We've got Surgeon General's reports on mental health. We have well-being trust reports. We have Trust in America's Health reports. How many reports do we need in order to do what we already know what to do? And it's time we get about doing it as opposed to studying it. I'll pick those up later on. Depends on the coverage. Patrick Kenedy littered the podium. Maybe that'll be Fox News. I don't know what that. No, we've got some friends there too. These illnesses obviously know no political boundary. When I came back from that horrific event, I thought my political life was over, as it should have been, DWI, humiliation, whole thing. I came back on the Hill, and although I thought I had been somewhat public about my challenges with mental illness and addiction, it clearly never was that on many people's minds like it was after I got into that car crash. And you would be amazed how many of my colleagues in the Congress who I never talked to before, who I walked by in the hallways, suddenly wanted to talk to me. And when I went to their offices with my staff, they'd always say, "Let the staff stay out there. I want to talk to you myself." And these were Republicans and these were Democrats. And to a person, they all wanted to tell me their story. Because, you see, I was the only one that they knew of all of our colleagues, that was either one of them or one of their family members. And when I thought I was the most isolated, I became the most included, because now I had colleagues asking me how I was on the floor as we were voting, take me aside, tell me their own stories, and because, as we all often are when we're in recovery, we're all anonymous. I mean, we don't know who in the room is one of us. But after that car crash, everyone knew who I was. And that, instead of being the worst thing in the world, which I thought it was initially, became the best thing in the world. Because I used to have to go all around this town and go through all those cocktail receptions and all this receptions here, receptions there. Now, when I walked in the room, everybody who was a friend walked to me. So I was never alone anymore, like I always felt alone before. And what a miracle in recovery that we find each other, we support each other, and that's how a real recovery works. And so what we really need to do in this movement is to gain the political will to do what we already know what we need to do. And I think it all revolves around one principle, and that's the same. Because these priorities are simple, very simple. We want the same prevention. We want the same access, the same recovery for mental health and addiction that we have given to every other major public health crisis in the history of our country. At the very least, I want that 24-year-old who overdoses or that 39-year-old who contemplates suicide to be valued as much as the person like my father who died in his 70s of brain cancer. I want an electronic medical record that prompts my doctor to ask me as much about my depression and addiction as it does my asthma. Yeah. I want a medical system to be as proactive about my mental illness and addiction as it is about my cardiovascular disease. Sure, I've got stroke in my family, but I'll be lucky if I die of a stroke. They've had me on Lipitor for 20 years. When is the medical system going to put as much prevention and energy and urgency into preventing suicide and overdose as they do stroke and heart attack? And we get to our doctor's offices. Do they ask? Well, they're starting to ask, but that's only because of pressure that you've put on. But it really is remarkable, the illiteracy rate amongst the whole medical community when it comes to these issues. And how many times I've gone into an ER and said I'm allergic to not only penicillin but opioids, and had the admitting nurse or doctor look at me like I'm from another planet. Because they don't hear that, because they don't ask that. Yes. And even after I tell them I'm in recovery from addiction and the propofol wears off, they've already given me a couple Percocets that could, thanks to my wife, I never continued taking, even though I insisted to her, well, I'm really hurting and I really need a little extra sleep tonight. And my wife grabbed that script and ripped it up. I thought almost for a second I was going to have to divorce her. I thought that's one step. That's the addict in my brain. The addict in my brain did not say, right first and foremost, I got 5 beautiful children. I've got a life beyond my wildest dreams. I've got a partner who's a soulmate. I've got a mission and purpose in my life. And yet all I could think about in my addict brain is, how am I going to get more? And the medical system's not doing anything to help me, because the medical system has no clue, because the medical system doesn't have any of this in the way that it needs to be in their continuing medical education programs for all the medical professionals that work in our healthcare system. So we need that kind of urgency. I worked with a bipartisan group, as Bob said, to pass the Mental Health Parity and Addiction Equity Act. And that basically said, inpatient in-network, outpatient in-network, inpatient out-of-network, outpatient out-of-network, pharmacy benefits, emergency room benefits. If you treat cancer in every one of those 6 buckets at the primary care, secondary, and tertiary care levels, you must treat mental illness. If you treat cardiovascular disease and diabetes in every one of those 6 buckets and give the right wraparound services and chronic care management for diabetes, you better do it for addiction and depression and schizophrenia. That's what the law says. And you can't charge higher copays, higher deductibles, higher premiums, or have lower lifetime caps on coverage. It is a modern-day medical civil rights act for people with brain illnesses, is what this law is. And like other civil rights bills, it depends on activism to implement it as much as to get it passed. Of course, after the '64 Civil Rights Act, we had the '65 Voting Rights Act, and then you had the Fair Housing Act and the Fair Employment Act. But we needed to have enforcement. We had the NAACP out there picking the jurisdictions where we could challenge the abuse of the law, where people were violating the Civil Rights Act, and enforce it. Because you know what? We still haven't gotten rid of racism in this country, but we've gotten rid of, to the extent that we enforce it, the practice of discrimination. So people can think whatever racist thoughts they want. They just can't go about their days here in America and think that they can practice those without being in violation of law. And people often say what we need in this community is anti-stigma. I couldn't agree more, but anti-stigma is not going to get it changed as much as changing behavior and then seeing a change of attitudes. In recovery, that's what we know works. Thinking our way is never going to get to where we need to go. what gets to where we need to go is changing the way we act. It's the essential element of cognitive behavioral therapy. And that's what we need for our country. Cognitive behavioral therapy for our nation. So, the investigation of a Millman Corporation. This is the most conservative, big corporation, Fortune 500 kind of analytics, you know, Rhodes Scholar crowd you could ask for, all right? All the big businesses, you know, they do work with Millman to do all their, like, special audits and feedback and analyses, okay? Millman Corporation analyzed 46 million payers' claims data. And they found that in every one of the 50 states there, no surprise, huge disparities in the access to treatment for mental health and addiction that do not exist when trying to access care for some other medical condition. And you want to go on the Kenedy Forum website, you can look there at our Parity track. That's our way of looking at how parity is being enforced in all one of the 50 states. And if you're interested, we have model bills that you can advocate for in your state legislature, wherever you're from, that give your insurance commissioner in your state more authority to do audits of insurance practices so as to ensure that people in that state are protected from discrimination against their illnesses. And so they found, no surprise, that primary care doctors are paid over 20% more for health care than were mental health practitioners providing that very same service. And what we need to do is we've seen that mental health providers are paid the same. We'd like more, but right now we're just demanding the same. Let's be consistent here. If it's good enough for cancer, those trillions of dollars that we spent in cancer for the last 4 decades, and I was on the Appropriations Committee, no one bothered to ask a question as to whether those numbers were too high. No one questioned. Oh, that's too much cancer research money. Oh, we're giving too much money on cancer. No. No, I mean, it's like, went right through the Congress, over and over for the last 4. And thank God. You know what? Thank God. My sister had lung cancer, my mother breast cancer, my father brain cancer, my brother bone cancer. We all benefited from that. Thank God there were Americans 40 years ago pushing, like my father, for that war on cancer. But what we need for this crisis of our time, this is the cancer on our country right now, is suicide and overdose. When are we going to wake up and see it for what it really is? So we want the same robust networks. We want the same funding. The height of the HIV/AIDS crisis in 1996, we were losing 50,000 people. And guess what this country decided to do? They decided to appropriate $25 billion a year for 50,000 lives. Just pause on that one just a second. Because if you go and ask any member of Congress, how are we doing on the overdose or suicide crisis, they're like, oh my God, we just passed this bill and that bill. We just increased the funding all the way up to $6 billion. We're losing 120,000 lives. When you count the 72 for overdoses, over a third of which are suicide that we can identify, and the additional 47,000, which, as we all know, is a lot lower than it really is. You're blowing into 150,000 lives lost, and we're all doing jumping jacks that we got Congress $6 billion. And I guarantee you can ask our best advocates up there, Howard, I think we're doing pretty good. And you know what that is to me? That's denial. That's us walking into our living room when our loved one is walking through inebriated, or our loved one is sitting catatonic, and us just going about our lives because we don't know what else to do because we're stuck in that situation. That's what it's like right now in our country. We're in a collective denial in this country about the real implications and impact of these illnesses. And that is why insurance industry can really get away with the denials they've gotten away with, because no one's demanding any differently from them. Because as Frederick Douglass said, power concedes nothing without demand. It never has and it never will. We're not going to get the changes we seek unless we demand those changes. We never got the Civil Rights Act without there not being a huge rally on the Mall. And that's what it's going to take. And we have to, as a nation, challenge ourselves to come out of our own shadows and make our voices heard. And that's why what you're doing here is so important. So what we are looking for is the same funding. You know what that would be for us? A minimum of $500 billion over 10 years. So $6 billion, $5 billion. I'd say that's pretty big difference of what we really need. And the aha moment is that even our best friends are proposing $100 billion over 10 years. And we think that, oh my God, $100 billion. When the president's already passed Congress a $2 trillion bill, right, through the tax cut. I mean, that's where our priorities were, just so you know how the money gets spent. That was no problem, but spending that much money over 10 years to change this country's health so that there isn't this existential crisis facing us as a nation, this is a national security issue. And until we treat it as the emergency it is, we're never going to be able to get people to wake up and dedicate the same emphasis on research and prevention and treatment, of integrated care and coordinated care and response that we've seen with every other public health epidemic. We want no more discrimination because these lives are on the line. And the egregious way that some insurance companies practice medicine today leaves many lives lost. I have a little game I want to play with you. It's called Jeopardy. You ever heard of it? First clue is for 200 points. Tell me the insurer who fired a medical director after a 60 minutes investigation revealed that he denied mental health claims 92%. So then he was fired. And then he was moved in that same network of health care insurer to run another state mental health program. Like a bad priest being moved around the church. Next clue, 400. Insurer that flagrantly violated parity laws by charging higher copays than those for those seeking substance use disorder care and for care for autism. Next clue for 600 points. Name the major insurer denying residential treatment for patients suffering from an eating disorder and depression based on internal guidelines that are illegally restrictive and directly at odds with standards of care. Final clue, 800. Name the insurer who set illegal limits on visits and burdensome pre-authorization requirements for substance use disorder treatment, all the while doing nothing to limit overprescribing of OxyContin. The sad fact of the matter is that any one of these insurance, and these were each separate major insurers, is that it could be said of almost every insurer that they are guilty of one or more of these also. So we need to call on Congress, and that's what I'm doing today, to host hearings on the enforcement of the mental health parity law. And I expect the United States Congress to host these hearings in the fall. And I expect them to get to the bottom of what we can do to better enforce this law and plug the gaps that continue to exist, including the payer that's the biggest violator of parity of them all, CMS, Center for Medicare and Medicaid Services. So we need to tell everybody out there who's for Medicare for all, wait a second. Medicare for all means discrimination for all. Let me repeat that for the whole audience out there. Medicare for all means discrimination for all. If you don't, as a presidential candidate, correct yourself and say that Medicare, as applied by parity to be compliant with the federal parity law and whose programs are in consistent compliance with the federal parity, then that Medicare for all will look at and consider. But we don't want to embed in law age-old discrimination and age-old stereotypes by going forward with this thing. So let me just say I've been honored we have to fix the TRICARE for our veterans. Can you imagine our military who are wearing the uniform of our country and their families are last in line for mental health services in our country? Why the Congress has not done anything about that? But of course, why haven't they done anything about the 22 to 23 suicides a day of our nation's veterans? Our fight is our veterans' fight. We are in it for our veterans. And I just want to say, when most of the folks that fought in Iraq and Afghanistan were Guard and reservists, you know what that means? They're covered by their privately insured, employer-based coverage. So when parity is being violated in all of these Fortune 500 companies because their third-party administrators are not adhering to the law, guess who some of those employees are? They're OIF veterans who are now suffering from the invisible wounds of war. They need help, and when they get their rights violated to equal access, all of our rights are violated. And that's why standing behind them is going to be so crucial for our efforts. Because I can tell you, if we can't get it right for our veterans, how in the world are we going to get it right for the rest of Americans? If Congress can't even address that, how can we address the lives of all the other Americans who are now being lost due to this scourge on our society? But I want to thank you all for the honor of letting me speak to you today.
All right. So, we have some questions for Patrick, and this is a good segue question. Why don't we use the federal fraud legislation, the False Claims Act, to enforce parity of Medicaid? Federal money is being used to provide Medicaid and CHIP recipients health care that is supposed to include behavioral health care. When it's not provided, taxpayers are being defrauded. What do you think?
So I think that's brilliant to have these types of approaches. I've heard one, why don't we apply the Equal Protection Clause to folks with these illnesses because they are being discriminated against and they're not being protected. And why don't we also enforce the Americans with Disability Act? You know, that there are vehicles all along the spectrum legally for us to push back. But my view is, my humble opinion, is that all we need are the people in this audience, this number, roughly this number. You need not even 8 stories. And then you need to make an appointment with the Attorney General in each of the states. And believe me, in this political environment, there's no elected official that's not going to meet with you. And if you say, listen, we've got these personal stories, they all follow a certain kind of narrative. They're all, for example, stories of heavy pre-authorization for medication-assisted treatment, or heavy concurrent review, restrictive, analyses, or, just come up with it. We have a lot of this going on at the Kenedy Forum through our Parity registry and our Parity track. And then what you do is you just go to the AG and say, listen, we don't know if this is happening everywhere, but with this payer in this state, here's what we're finding. 8 cases. Then what you do is you bring in the Millman report. And you say, and in our state, this is what the Millman report found. It found huge disparities. So when you marry the anecdotal with the macro statistical, bring that into the AG, well, any politician's going to say, geez, I don't want to be caught behind this freight train. Okay, I'll call down. And that's what the Attorney General in New York did. And the Attorney General in New York got consent decrees with several national payers. And guess what? It resulted in national standards by those payers being changed. In other words, a group of dedicated activists in one state helped change federal practice. Which is why each of you is important, because in some states, we're going to have better friends than other states who will take this on. And our job on the national level, with your help, John, and Bob, what we're going to need to do is look at where the advocacy is the most kind of put together and where it corresponds with the political environment that is the most, open, and then combine those two and try to get a victory. Because rather than all of our family members trying to be like a PhD, JD, MSW, whatever it is, to try to figure out how to file an appeal for a wrongful denial of care, you're going to need to go to law school to understand how to do that. And I think the political process will short-circuit everyone having to fight by themselves. Plus, with our Parity registry and track, we're seeing things on a national basis. So if, like in Arkansas, you have this experience with this payer, and we're seeing it in California and New Hampshire through our portal, which, by the way, we're all on board with working to build together, then you can say, oh, well, these are standards where they got cited in another state. So we do a letter to the insurance commissioner in all the other 49 states, say, Mr. or Mrs. Insurance Commissioner, did you know that this insurance plan, which you put your name to, which you signed off on as having met all of the legal requirements of federal and state law, because they have to uphold the law. That's part of, when you swear to uphold the Constitution of the state, that's what you're doing. Here's what you need to do. How are they going to not do that? And you'll get a handful of them will start doing things. And all of that coming together will help make a difference. And granted, we've got a long ways to go, and it's not just relegated just to the insurer. It's relegated to, as I said, the way the states fund programs, the way the federal government funds programs. But every piece of this has to be pushed.
Okay, Patrick, that's great. We have time for one more question. This comes from our Chief Medical Officer. I attended a National Academy of Science meeting last December, and they brought up the topic of bundled payments. What's it going to take to get CMS to provide bundled payments to physicians to provide bundled services for not just physical health, but mental health?
Well, President Kenedy signed the last bill President Kenedy signed before he was assassinated was the Community Mental Health Act of 1963. He signed at the end of October and was killed in November. And when he signed that bill, with his sister in mind, closest in age to President Kennedy, was my Aunt Rosemary, who had a psychiatric disorder and was given a lobotomy for it, and was banished from the family for decades before being able to kind of come out till he was already well in his presidency because of the shame and stigma. He signed that Community Mental Health Act as a family member who's seen the impact of what these illnesses do and the shame that accompanies them. And he said, people with mental illness need no longer be alien to our affections or beyond the help of our communities. And when you ask that question about bundle payments, I'm thinking communities, because I'm not thinking just a medical response. I will tell you, Horizon Blue Cross Blue Shield ought to pay my 12-step support group hundreds of thousands of dollars for what my trudgers saved New Jersey Blue Cross Blue Shield because I was in 12-step recovery. I racked up more emergency rooms for more contusions and lacerations and concussions. And I racked up more time in and out of blow-dry rehabs over and over and over again. And now, you know, I have an ASAM doctor who monitors my mental health, but also knows about addiction, which, by the way, none of my other psychiatrists knew about. It's part of the problem, because don't think that every mental health professional actually knows everything about your particular disorder. And I've got a community of my fellow peers who, like me, are fighting every day to stay sober and healthy. And I've got protective factors. I've got 5 beautiful little protective factors running around my house. And I've got a spouse who understands and lets me go to meetings and encourages me to go sometimes when I don't want to go.
Excellent.
And she knows I need to go. But my point is that, you know, I've got a biopsychosocial. 3 prongs. You need the bio. I take the meds, okay? You know, you need the psychological. I have a psychiatrist, but I also get the cognitive behavioral therapy through the best program of all. That's 12-step recovery. And then the social is really the spiritual, because I have a spiritual malady as well. And that, to me, is not too complex in this world of great complexity. It's only 3 things we got to get to varying degrees plugged into the equation. And if we do that, we'll save, and I hate to have to say this, and we always do this, we're going to save money on the physical side when people take care of their mental health. But we all know that, but why in the world do we have to say? They never made us promise when we funded cancer that it was somehow going to save money. We funded cancer because it was going to save lives and it was going to improve the quality of life of all Americans, and that was the down payment we made. So why are we cutting ourselves short when we say that we have to prove this on a value-based model, even though bundle payments and risk-based contracts and value-based purchasing, I think, will be the explosion of mental health, because all of these insurers are finally going to realize the secret sauce in healthcare reform is finally addressing the thing we long neglected, and watch all these other comorbidities start to drop and the complications and the costs go down. And so we may end up seeing more money spent on mental health in order to save a lot of money on the physical side. But I'm just telling you, I hate to have to make that argument, even though there is all the evidence in the world to see it stand up under critique.
Okay, thank you. So I think Patrick has a video he wants to show.
Yeah, so
and then introduce a special guest, and then we're going to wrap up. So
you all know our great friend and hero, Senator Gordon Smith, who was instrumental in obviously passing the Garrett Lee Smith Act, which is the largest suicide prevention program for youth. And I just got off the phone with him before I came up here, really an hour ago. And he can't be here now, but he's going to appear and do events with us at mentalhealthforus.net, mentalhealthforus.net. And the 4 is not F-O-R, it's number 4. Okay, mental health. Okay, you got that? Mental health. Oh, it is F-O-R? Okay, sorry. Now you'll remember it. That was just a trick. You know, now you're paying attention. Mentalhealthforus.net. So he has been a good friend and mentor to me, and I love the guy for all that he's done to take his personal tragedy, but turn in the other direction and run towards the problem, so, like all of you do, instead of away from the problem, which is what your natural inclination is to go run and hide. He's been out in front. So he's agreed to be our co-chair of the Mental Health for Us campaign. Not a bad guy to have as your co-chair. And he happens to be a Republican, which means that we get to, on the surface of this thing, in political correct terms, get to, although we'll probably have to put some more Republicans just to balance out one Kenedy. It'll immediately be tainted because, there's a Kenedy involved. I might have to break out all my buddies on the Republican side, who, by the way, I have many of them who are going to be helpful to us in this effort. But we'll hear from Gordon Smith, and then right after Gordon Smith, we're going to hear from Dr. Cornier. And Patrick Cornier is the medical director of Kaiser Permanente, which, as you all know, is a healthcare organization that believes in comprehensive care management, that there's only one way to treat someone, and that is in a coordinated, integrated way. I've discussed with him, as he knows, I've had the pressure I've put on them has been quite considerable. I've stood outside their offices protesting in the past, but I want to salute them when they're stepping up and they're doing the right thing, because this is not a zero-sum game. There are some insurers out there who need to do a lot of corrective action, and when they do, we'll be out there applauding them too. So we want them to know that. We need them to do the right thing because their lives, there are family members' lives on the line, and we need to help them do that. And Dr. Cornier will speak just after Gordon Smith. So right now is the video from Senator Gordon Smith.
Hello, my name is Gordon Smith. I regret that at this kickoff event I am tied up in a board meeting for my day job, but I am honored, pleased to join with my longtime friend, Patrick Kenedy, at this kickoff event of Mental Health for Us. I'm aware that mental health and suicide prevention have come into most of our lives as a howling reproach, a horrible time of pain and sorrow. And it is because of that and all of the wonderful organizations that are gathered here that I want to express my gratitude. Those of us who continue to work in the cause of mental health and suicide prevention, I've often felt that we're doing heaven's work. We work on the side of angels. And you might have noticed that Patrick is a Democrat, and I served in the Senate as a Republican. But this is an issue that doesn't register in a partisan way. It simply is a human affliction, and it makes no discrimination. And so as you go forward in this event, coordinating your efforts to provide intervention and prevention, hope, healing, access and affordability to mental health services, remember that you're speaking and working on behalf of some of our most vulnerable brothers and sisters in society. So my congratulations to all of you for being involved in Mental Health for Us.
Dr. Cornier, I love his first name, Patrick. Thank you, Patrick. I said he had to get
here and present, because if I wasn't able, we have another Patrick to attend and speak about mental health. Dr. Cornier knows a lot about this. He's struggling to try to get all of their patients enough access, but he also knows that we need the federal government to step up and the state government to step up, because with the workforce shortage that we have in this country, we just don't have enough providers to go around. And that's on the federal government to do through its loan forgiveness programs. We have high need categories in the education budget that we fund as members of Congress. That's part of our agenda. We need to do that. But frankly, we need more payers to use their voice to get, because sometimes they have a little bit stronger political pull, to get our elected officials to make this a priority. Because if they don't, they're going to be stuck with us protesting them, because they're never going to be able to plug the holes on the access issue if we, for example, do not do enough to provide enough of a trained workforce. So, Dr. Cornier, you know, we haven't always seen eye to eye, but I have to tell you, I respect the fact that you and Kaiser are willing to step up, be part of an initiative, take on a political role of trying to make sure these issues are addressed on a much more broad-based way. And thank you again for being here.
Thank you, Patrick.